Hello everyone and welcome back to my YouTube channel. Thank you to my returning subscribers, and if you are new here, I'm Mr. Brain and I discuss everything health. Today we'll be discussing infertility. So what is infertility? Infertility is defined as the disability of the reproductive system, which is defined by the failure to achieve pregnancy after 12 months or more of regular unprotected sexual intercourse. So if you have been having unprotected sex for more than 12 months and you have not yet achieved pregnancy, then you are said to be infertile. So there are many causes of infertility. I'll be dividing the causes into the male and female causes. So firstly, let's look at the male infertility. That's the causes of male infertility. You have absence or low level of sperm count. So if there's no sperm or your sperm count is low, that can lead to infertility. Abnormal shape or motility of the sperm. Motility is like movement of the sperm. This can also lead to infertility. So what can possibly lead to this low sperm count or absence of sperm or abnormal sperm shape? So if you addicted to smoking, like you smoke regularly, excessive alcohol intake, obesity, or if you're undergoing chemotherapy, that's treatment for cancer, this can lead to the above two causes I've mentioned. Okay, so obstruction of the reproductive system causing dysfunction in ejaculation of sperm. So possible example of this is when there is blockage of the ejaculatory duct and the semen vesicle. So these are tubes that helps to carry out semen, and the blockages are commonly due to injuries or infection of the genital tracts. Then the next possible cause is hormonal disorder, leading to abnormalities in the production of male reproductive hormones. Example is the testosterone, which regulates the sperm production. The next is the damage or absence of testicles. So what can lead to damage or absence of these testicles? One is when you have infections of the testicles, if there's testicular cancer, injury to the testicles, or congenital defect of the testicles, such as undescended testes. So this can lead to damage or no testicles being present at all. The next one is drugs. Certain types of drugs can lead to infertility. Example, chemotherapy or use of herbal medicines can also cause infertility. Then sterilization. So this is literally a surgical procedure that interrupts the anatomical pathway through which garments leaves the body or travels around. So sterilization of the male reproductive system is what we call vasectomy. Someone who has undergone vasectomy cannot be able to impregnate a lady. This leads us to the causes of female infertility. They ranges from disorder of the ovaries, such as polycystic ovarian syndrome, when you have tubal disorders, as disorder of the fallopian tubes, example when there is blocked fallopian tubes. These blocked fallopian tubes can be caused by untreated sexually transmitted disease. An example of these STIs is pelvic inflammatory disease, which can affect the genitals, that the female genitals, ranging from the womb, the fallopian tubes, and the ovary as well. Then this leads us to ovarian disorders. Uterine disorders such as endometriosis, congenital abnormalities of the uterus or absence of uterus, or when there's presence of fibroid as well. This can also lead to infertility. Then we have disorders of the endocrine system, which causes imbalance of the female reproductive system hormone. Examples of this disorder are disorder or cancer of the pituitary gland or hypothyroidism, and also sterilization in ladies. Example is the bilateral tubal ligation. This can also cause infertility in ladies, and also drugs as well can also lead to infertility in ladies. Then that leads me to the diagnosis. How can you diagnose infertility? So in males, you can diagnose infertility by carrying out a physical examination, and this physical examination includes examination of the testes, and what are you actually trying to look out in the testes to check if there's any abnormality like lumps or any noticeable defects. Also assessment of the penis for its shape or any abnormality in its shapes, structure, or any obvious abnormality as well. Then carrying out a semen analysis. So this semen analysis is actually carried out to check your sperm count, the shape, and its motility, that's its ability to move or how far it moves. Then infection checks are being carried out as well to know if your infertility is as a result of any infection, okay, and to actually know the infection that led to the infertility and possibly guide your doctors in appropriate treatment as well. Then you have the blood test that checks out for your hormone levels. Then let's move over to the female diagnosis. So how do you diagnose a lady of infertility? You also have to carry out blood tests for hormone levels as well. Then you carry out urine test or vagina swab, which is sent to the lab. And what do you actually want to gain from this urine test or vagina test? It's actually to check for infections. Then you carry out ultrasound scan. This ultrasound scan is actually aimed at checking the ovaries, the fallopian tubes, for conditions such as PCOS, that's polycystic ovarian syndromes, or endometriosis and fibroid as well. So the next way to diagnose infertility in ladies is laparoscopy plus dial test. This is a surgical procedure that aims to look at the abdomen and the pelvic organ, particularly the fallopian tubes. This can also dictate conditions such as pelvic infection, endometriosis, issues with the ovaries such as ovarian cyst and fibroid as well. Then the last but not the least is hysteroscopy. This procedure allows the doctor to have a view of your uterus and actually know what's going on there and if the cause of your infertility is from that angle as well. Moving over, we'll have to discuss the treatment of infertility. This treatment varies and it also depends on the cause. They can be classified based on lifestyle modification, use of medicine, surgical procedure, or assisted conception. Let's look at the possible treatment in ladies. So in ladies, you have the lifestyle modification. This lifestyle modification includes losing weight if you're overweight and trying to gain a little bit weight if you're underweight, like low BMI than expected of your age and height. Stopping of hard drugs, because this also leads to infertility as well. Stop smoking, then cut down on excessive alcohol intake. Then the medicine. You can make use of ovulation induction drugs, make use of metformin. You can use gonadotropins. So these gonadotropins are drugs that contains the follicle stimulating hormone and the luteinizing hormone. If you've watched my previous video on the menstrual cycle, you should be able to know what this hormone does. I'm gonna drop a link of my video on the menstrual cycle in the description box, okay? So you should be able to know what this hormone does. Then use of letrozole and clomid, okay? Then you also have the surgical treatment, which includes myomectomy. This is being done if you have fibroid. So basically it's the removal of fibroid from the uterus. Then you have fallopian tube surgeries. If your issue is from your fallopian tube, then you're going to have a fallopian tube surgery to sort yourself out. Then you have laparoscopic ovarian drilling. This is basically for people with PCOS, polycystic ovarian syndrome. And most times this is done if the ovulation medication has not worked for you. Then this is the next available option for your doctors to explore. Then the last but not the least is the assisted conception, which includes the in vitro fertilization and the intrauterine insemination. In the in vitro fertilization, this is when the egg is fertilized outside the body and then the embryo is returned to the womb to grow and develop. Mind you, it's very expensive, but its success rate is close to 100. Then you have the intrauterine insemination. So in this procedure, the sperm is collected from the man and then washed The best quality sperm will be selected for the procedure, then inserted into the woman's womb using a thin plastic tube or catheter passed through the cervix. Okay. Then the male treatment also has lifestyle modification, so you have to modify your lifestyle. Stop taking hard drugs. Try to lose weight if you're overweight. Try to gain weight if you're having a low BMI than expected of your age, weight, height, etc. Then stop smoking. Limit the number of alcohol you also take. So drugs that can be used is gonadotropins as well, antioxidant and testosterone. Then you can also undergo surgery such as urethroplasty. This is beneficial for those that has urethral pathology, if you're having urethral strictures. Okay. Then the next one is varicocelectomy. This is the removal of swollen veins in the scrotum, and these swollen veins can be called varicocele. Then you also have the assisted reproduction for males. This includes testicular sperm extraction, TESI, and the percutaneous epididymal sperm aspiration, PESA. So we've come to the end of today's lecture. Thank you very much for watching the video as usual. To my returning subscribers, this is me also saying thank you once more. Please don't forget to click the subscribe button and the notification bell to get notified on when next I post my new videos. And also note that the comment section is always open for you. Pop in your questions, ideas, or any topic you want me to discuss in my next video. Thank you very much and see you next time.